my 3 little remedies, which is lavender, those 3 are helping out. Lavender and
frankincense and lavender are my 2 go-tos.
Yep, they're always my 2 go-tos.
That's I bathe in them. Oh my God.
Hello, Essential Oils for Life. Welcome.
Oh, really? I put it in my drinks all the time. I put it like in a shot glass.
Hey, Bridget. Thanks for being here. If you feel the urge, show some hearts. Yay, thank you. We're going to get started here in just a minute. Fantastic, thank you.
And on my adult ones are in lavender and white.
Hello, Sherrykins22. Welcome.
Working in DNC and library is about trying to sell a product or trying to help. You genuinely want to help. You can't be a doctor, you can't present it as, your profession, but
Hey, Batman 1949. Welcome.
you can add to your regimen, and if it works for them, then they can choose to switch. I'm just excited to learn about everything my mom's going to learn about.
Well, this is my first class on this, so you're not alone.
I'm new, but it's not my first class. I stumbled across the products on my own and played around on my own. And got some amazing results.
Is it possible to get like a cup of water in the microwave so that when I make my...
Yeah, you want to stand here and hold this for just a minute? And I'll go give you some.
And then, it'll just probably need to microwave for like a minute.
Okay.
Before
What kind of cup? Like a plastic cup, okay? Or a glass cup or something?
glass, just so the plastics doesn't...
Yeah.
Otherwise, I wouldn't use it. So it was the oils that I made. The stuff that was after was to remove the cancer stuff. So I had skin cancer, remove face on the top. On the other side, I had to quit working in a department because of skin cancer. They take So I was very concerned about face skin cancer. And I got rid of all my freckles and all the spots. I only have like 2 spots left. Frankincense, lavender, and myrrh were my base. But I put a bunch of other stuff in This one right here, my arm, that one, it used to be black. That was the first one I targeted. That thing was black. Like 5 years ago. It was completely black. And it started to concern me. And that's why I used that. I've got a tub of shea butter. They're about 70 ounces. Then I got Java. Vitamin E. And then I took another 20 ounces of coconut milk. I have a 40-ounce base that I put up. Making sure you ask me about my energy. And then I pulled off of that, and I put in like 20 drops of frankincense, 20 drops of baby, 20 drops of vitamin water, and then I put in a drop of oregano to open the south. Put in a couple drops of cypress to push it in. I put in all the sage myself.
No, I would just leave it in there, and then like right before I'm gonna make the toothpaste, heat it up because it needs to be like really. But it's gonna be like 35 minutes probably before I get to the toothpaste. So I'll just I'll signal, and then we'll just hit the microwave for like a minute.
And it burns for about 5 minutes. It takes about 5 minutes to burn.
Yeah, so I would just leave it in the microwave, and then before I need it, I'll kind of just signal, and then if we just nuke it for like a minute, and then that way it's like piping hot when it.
When I went and got my blood test last time, it was like my sugar was normal.
They hear me the whole time.
That's Allie.
We're going to go ahead and start with our class presentation. Wasn't that much awesome? Is Natalie still here? Let's give her a big hand. And then our presentation today is equally as awesome with a dear friend of mine who I love and I respect more than I can say. I honor her for the journey that she's been through. If you don't know Allie, she is a cancer survivor 3 times. And she's just got so much courage. So I'm just so happy that she's here. She has a great message for us. And what we do with these classes is make sure that we kind of touch all bases. Our health has many facets. And so, like I said, we maybe forget about our teeth and how important they are. And she has an important message for us so that we do this right. So now we're going to turn the time over to Allie Wishner.
Thank you.
All right. So, thank you for that. By no means am I a fantastic public speaker. If you guys were here last time, it was kind of easy to, not really easy, but easy to talk about my story because I'm an expert in my story. However, as a disclaimer, I'm not a dentist, I'm not a dental hygienist, I'm not a professional speaker, hence lots of notes to keep me on track. However, I am somebody that advocates for my own personal health and for the health of my family. And for everybody that knows me, I have to advocate for you too. So this was a subject that was really interesting to me. So basically, I just want to reiterate here that by no means is anything that I'm going to say today is saying that I'm an expert in the field. The only thing that makes me an expert is that I have teeth, some of them, and that I'm really into dental health. My smile has always been like my thing. That was what everybody would always notice previous to a removal. As that, I was like the girl with the $1 million smile. And I never knew how important it was that I was taking care of those teeth for that $1 million smile. There is a lot of controversy out there from conventional dentistry to holistic dentistry. So today I kind of want to merge the two together and kind of give you a more hybrid approach to taking care of your teeth. So more of the using the holistic and the conventional together. So basically back in September of 2015, I'll kind of step back a little bit. When Joan asked me, Allie, do you have a class that you can teach? I was like, not really. But there was this class that I keep saying, I'm going to teach a class on this. However, because I'm not an expert in the field, it's kind of hard to teach a class on something that you're not an expert in. However, I'm really passionate about it, so hopefully I will do you all good. But I watched back in September, hopefully some of you may have seen it, but it was the Holistic Oral Health Summit, and it was a 6-day webinar of 30 hours of 34 well-renowned doctors talking about dental health. Exciting, right? Maybe you guys could watch 1 hour and be like, okay, that's enough. I watched all 30. And, what I learned was that there could very possibly be a correlation between my having cancer and my own personal oral health. So the main focus of the summit was that, their kind of slogan was, one uneducated visit to your dentist could have lifelong ramifications to your health. and that it could be devastating to you. So some of the things that they brought up, and you may have heard, and you know, I'm absolutely open if you're skeptical to any of this, but was that 80% of disease is caused by problems in our mouth, and that millions that we are exposed to dental procedures that can make those problems even worse. Oral health is the most overlooked health issue in conventional and integrative medicine. And so you kind of think about it like, you know, you have a severe pain or you cut yourself, or think of the reasons that you go to the doctor. However, if you have anything going on in your mouth, that is like more important than the stitches, because 80% of the diseases are coming through what is going on in your mouth and then going into your body. 90% of heart attacks are caused by oral pathogens. Autoimmune disorders can be resolved by getting rid of toxic dental implants. Reversing gum disease can help you get rid of digestive problems. Root canal procedures can actually put you at risk of cancer and having degenerative diseases. And that dental health problems actually have a very strong direct link to chronic disease. So, like I said, he got together these 34 doctors, and you know, to save time and us not be here for a week, I kind of tried to narrow it down the best as possible and cover the things that I felt to be really important. But when we think of our teeth, some of you may have had periodontal disease or know someone that has periodontal disease, and I think you smell periodontal disease in someone's mouth. It's very common. But the more common things that we deal with are, you know, having cavities, getting fillings, root canals, crowns, maybe getting an abscess in your gums, gingivitis, having our wisdom teeth extracted, and then periodontal disease, leading to bone loss. One of the biggest factors that causes periodontal disease, I just totally said that word crazy, is if you are a smoker, you are the highest percentage at risk for having periodontal disease if you are a smoker. Another thing that can happen for us women when we are having like hormonal changes or maybe having that time of the month, it can cause inflammation in our mouths. So if you happen, and I learned this, I was actually reiterated from Debbie Dixon over there, that you may go to the dentist and be a little bit more sensitive, or when they do the probing, have a little bit deeper depths, and it could only be related to the fact that you're just having a hormonal going on in your body, and it's not necessarily that you've got massive periodontal. I can't say the word. I'm speaking Gum disease. Diabetes puts you at risk of having gum disease, as well as gum disease could actually put you into like deeper diabetic complications. And then, so there's just a myriad of other illnesses that can really trigger the bacteria and stuff in your mouth and causing inflammation and problems in your mouth. And then medications. There's medications that they actually will slow the production of saliva in your mouth, and we need the saliva in our mouth to help have the bacteria not colonize. Would that be correct? Yeah. And so when you take these medications and they say give you dry mouth, you're actually getting more bacteria forming in your mouth, making you high risk.
And the one thing a lot of people ask, so what's a big deal if I have bacteria in my mouth? Like you're talking about the gum disease and how it associates to all these problems. And it's because when you have the gum disease, you get little micro tears in your gums, and all that bacteria that is so strong enters your bloodstream. It goes through your heart, it goes through your lungs, it goes through all of your organs, and it's the strongest bacteria in our bodies or anything we're exposed to, and it's going through and your body has to try to fight it. And so it causes huge, huge problems. And our saliva has something in it called lysozyme. It kills bacteria. So when you're taking the medications that make you have dry mouth, then the bacteria just explodes, and then it goes into the body, and then it just causes, it just all topples on, goes on top of each other and just causes major problems.
And then there is, you know, some people that are just genetically susceptible, and I put myself in that category. And everybody's like, oh, you have such nice teeth. Yeah, you should see the ones in the back that went away when I was 10. You know, like she kind of went into what would cause it. But, so it's bacteria in our mouth that causes, you know, gum disease. And what happens basically is that bacteria starts to colonize in our mouth. And if I get this right, you get a biofilm in your mouth of bacteria. And that biofilm has like a chain to it where if you don't break the chain, it will keep building onto each other. So cleaning your mouth and especially flossing your teeth every 12 hours will help to break that biofilm from being able to have that plaque actually turn to tartar. Because plaque, we can brush that away and get that out of our mouth. When it actually hardens and becomes tartar, that's when you have to have like a dental hygienist or something remove it. So when you let that go for long periods of time where you're building this tartar and plaque in your mouth, then that's when gingivitis happens. And that's the red swelling, inflammation, perhaps bleeding around the gums. You know, so as Debbie said, and how many of these people said, if you have any active bleeding in your mouth, so if you brush your teeth and you bleed, if you floss and you bleed, that's active infection in your mouth. So you should not have any bleeding going on when you're brushing and flossing. And if you let that go even further, then it becomes periodontitis.
And so one thing about the bleeding, sometimes if somebody has a crown, and if they've had it for years, if it doesn't have a good margin, sometimes they'll have bleeding. Like some people freak out, it's still bleeding. It, like if there's one place that bleeds all the time, even if you floss all the time, it's just, it's a foreign object in your body and your body's reacting to it, that's all.
So basically, I then took 9 of the talks, and I wanted to kind of just focus a little bit on each one of those factors. And, you know, kind of the gist of what I want you to get out of all of this is that if you have anything going on in your mouth that is going to lead you to needing to have any kind of extensive procedure that goes beyond a cleaning or maybe even a deep cleaning, to get a second opinion, because conventional dentistry works off of what the FDA says is okay, and there's a lot of holistic dentists out there that do not believe that it's okay to put these kinds of things into our body. So the first talk that I want to talk about was called Toxins and Bugs, the Dangers Lurking in Our Mouth. And basically going back to the bleeding gums, if you have bleeding gums, that's active infection in your mouth. So those bleeding gums are actually, you know, going into your bloodstream, going into your body. And we actually have parasites in our mouth, and we have mold in our mouth when we have this kind of stuff going on. Yes, there's something gross. So I don't know if anybody has ever had a root canal that's gone bad, or had a tooth that is turning black. That black is very quite possibly mold in your mouth. It's not, as they say, a dead tooth. That is mold growing in your mouth. But that bacteria and those parasites, when you have that in your mouth and you're constantly swallowing that, it can lead to having a lot of gastrointestinal issues and having gut issues. So something that they recommended that you could use is clove oil, cinnamon, and thyme. Swishing that around. Is everybody familiar with what oil pulling is? So oil pulling is, you know, coconut oil is a really good oil to use. So, you know, like half a tablespoon in your mouth because you're going to produce a lot of saliva. Uh-huh.
You can make little tablets, have the coconut oil, put the On Guard in it, and then when you do the oil pulling, you're using the On Guard, and you just do that with the On Guard.
Right, so what they're recommending is that it's beneficial to use any of the, antimicrobial essential oils in corporation with your oil pulling, and then make sure when you're oil pulling,
You can use
you're
fractionated.
pulling all of those toxins into your mouth. You do not swallow it. You spit that out. And oil pulling is really, really good, and I recommend that you look up, oil pulling, and, you can delve a little bit deeper into oil pulling. But that was something that I found to be quite interesting. Now, any of you that know me, I have to have the scientific proof behind everything because you can't just tell me something. So instead of doing testimonials, which there were tons of testimonials of people that, were healed from diseases and so on and so forth, from having dental procedures done, removed from their mouth, I just kind of went with is everybody familiar with PubMed?
Yes.
Okay. So, this right here is kind of just an overview of what I was able to find, and that there are 70 relevant articles just based around essential oils and dental care on PubMed. So there are 70 case studies basically on oral health. And that basically it says that on the basis of the available information, it can be concluded that essential oils have the potential to be developed and preventive of therapeutic agents of various diseases. And then it goes on for further clinical trials. And it lists that lavender, cinnamon, clove, eucalyptus, peppermint, lemon, and melaleuca were all pretty much the oils that you're going to find within all of these studies. However, going back to the pathogens and the parasites and mold, here is a study that was done in September of 2013. And the study was done with clove, peppermint, melaleuca, thyme, and lavender, and seeing what concentration they would need in order to kill oral pathogens. And it concluded that all 5 of them will kill oral pathogens in your mouth, and then just in certain concentrations. So if you're doing a gum rub at 100% concentration, I think you're in good hands. So,
I have a question.
yeah.
A Periscope viewer asked if periodontal disease is reversible.
Yes, absolutely. Our teeth are actually alive. Everything in there is alive. So if you...
So you can stop the disease, but the bone can never grow back.
Right.
And so you can, so is it reversible? We always tell people, no, you can never grow your bone back. So you can't reverse what it's done, but you can stop it, the infection and the disease. You can keep it from getting deeper. Now, once you've lost a certain amount of bone, there's no way, even with the oils, that you can clean down that deep. And so you would have to get other stuff done, because if you have a 9mm pocket, there's nothing, no oil can get, nothing's going to get down there to clean it. And so it's imperative to figure out what to do to make it cleanable. And so, yes, infection will, you can stop infection, but you can never get your bone back.
I actually went to the dentist not too long ago, and I was having an issue with gums bleeding, and I have some retention on my gums in the lower half. My grandfather had bad gums, so I wanted to get checked up, and they said I did have retention. It wasn't so bad, and I did ask if it was reversible. They said no, but one thing people are doing now, if it does get too bad, they do a skin graft from the top of your palate, and they'll actually graft skin onto there. And that is a way to fight that, but that is the only way. You can only maintain or get worse. That's the only thing. So it is imperative, and that's a big reason why I want to use the oils as well.
you know, like I said, I'm not an expert in it. However, one thing, and I kind of will, I'll address it now and skip over it when I get to it. But one thing that I learned is that most dentists, when they're doing like oral procedures, and I'm not sure how extensive that procedure is, if they would actually just put you out or what, but they use Novocaine with epinephrine. And the problem with epinephrine is it will actually shrink the blood vessels and stop the capillaries from doing their job, which is sending blood and oxygen to the area. So when they use this epinephrine so that there's less bleeding going on while they're trying to do the procedure. However, the danger involved in that is that you get dead tissue in your mouth because the tissue is dying while they're doing the dental procedure. So that would be something that I would, if someone was going to tell me that they were going to do a graft in my mouth, I would make sure that, what are they going to use to make sure that you're going to make sure that you have a nice living atmosphere when they're done. Heard that, Debbie?
So I've never seen the dead tissue because I do it all the time. The epinephrine, we have to take blood pressure on them first because it does. It's just like if you see a ghost and your adrenaline goes up. But without it, like with a graft, I don't know, it would be really difficult to do because the bleeding is so extensive you can't even see what you're doing. And so they do try to stop the bleeding. But I've never, because when people come back, we always check, and I've never seen dead tissue afterward. But on some people, if they didn't have good blood flow,
it's the same as like an implant. I don't know if you guys ever watched like these, where they get the implants. The whole thing, they're trying to keep the tissue alive while they're doing the surgical procedure. It's the same thing in your mouth.
Mine is the comment isn't about the tissue, but when you do go to the dentist, it's very important to ask to protect your thyroid when they x-ray you, and there is a special flap that comes up that protects your thyroid, and unless you ask for it, they don't do it. And there's a special little collar that comes up, and it's especially important. And well, because I've had a lot of dental work, and one day I'm like, here's an x-ray. I just took it from office here and bring it to office B. Well, we need our own x-ray. And I personally, in my opinion, have been over x-rayed. And so I will not allow them unless they put that collar on. But you have to ask for it.
They're supposed to use it for every x-ray. People get lazy, and it's usually assistants who are not required to go to school to learn about those things. A lot of assistants are just trained on the job, and it's just pure laziness. So yeah,
you must ask for it, or they'll pull. You can take the vets, the regular one, and pull it up. But protect your thyroid. If they don't have the ability to do that, then I personally would not allow it.
Good thing to know. I will remember that. I just had an x-ray done. It was the craziest thing. They had me stand, and they had me like put my head like on this thing and bite.
Oh, the crap.
And then run around my head. I was like, what's happening? And then they still stuck those ouchy things in my mouth and made me bite down on them.
And they do that. We check for cancer, cysts, and tumors. That's the only way you can see them, because they don't hurt in the jaw until they go further. And there's x-rays we've taken, and we can see a gigantic cancerous growth that somebody would know until it's way too late for them. So we recommend those every 3 to 5 years, just to check, and we find the craziest things in the jaw that nobody would ever know about. And in the dental field, it takes about 25,000 dental x-rays to equal one chest x-ray. And so be careful, like you go to the doctor and they want to x-ray you for everything, and I'm like, that scares me more. The digital ones now, that's very little radiation, but you should stay away from any extra radiation.
I'm a lightning bug at this point, and I'm like, you don't need to put that thing on me.
I bet you glow in the dark.
I probably do. So then another talk was, is it wise to keep your wisdom teeth? And basically, she got into the dangers of having an impacted or a cystic wisdom tooth, because that is just constant infection in your mouth that can lead to chronic disease. Because if you have your body constantly attacking something, your white blood cells are constantly going, and your body is in turmoil, and you can have chronic disease from that. It's just weakening your immune system. And so something that she talked about was that some people will say, oh, well, my wisdom teeth never came in. Well, it's important for you to go and have x-rays done, because she went into this whole thing like meso and ecto, and how that's like your tooth is an ecto, meaning it's supposed to be on the outside of your body and not inside your body. And so when you have an ecto in a meso environment, your body's like, get it out of there. And so you might not have any pain. You might just be like, oh, my wisdom teeth never came in, but then they're actually rotting into like cottage cheese in your gums.
Yeah.
And that when they go to take them out, it's like butter scraping your teeth out. So if your wisdom teeth have not been taken out, I would look into that. Now, but if they do come in, mine came in and they fit, that, just to make sure that you keep an eye on them, that they're not getting infected. But another thing that happens, and it kind of goes to that epinephrine, is that really common when you have your wisdom teeth out, they tell you, oh, dry socket is really common, and that, what is the other one called? Cavitization. Say it right. It's like when you have like an infected ball. It's because that's like a huge open wound in your mouth. And your mouth is like the dirtiest thing on the planet. And then you're eating, and you're trying to keep food and stuff out of it. So this went into that when you are actually having your wisdom teeth taken out, that it's a good idea to perhaps ask your dentist if they will clove the area to stop the production of bacteria around that site during the actual procedure, and then after, and then and then they'll probably give you a prescription for this.
You can flush it afterward with the oils. You can just get your own like little syringe. They give you a syringe to flush it with. Just put some of the oils in it, and that will.
And then keep flushing it. So let's see, where am I at? That one. Okay, so dental implants. So when I was going through my rounds and rounds of chemo, missed $1 million smile, lost a crown, went bad. So I need a crown, but what they also talked about is that metal implants are a foreign object in your body. When you put foreign objects in your body, what does your body want to do? It wants to get rid. Did you have a question?
No, get rid of it.
It wants to get rid of that foreign object. So when you put a metal plant up into your bone, your body is now in constant, fighting to get that thing out of there. So there was actually a dentist on there that had said that he felt so bad as being uneducated, putting metal implants into people's mouths, that any one of his patients that he put a metal implant in, he will replace it for free with a non-metal implant into his mouth. He was like, just come back and I will fix it, because I feel that bad for putting something in your mouth
They have
that's...
so many problems with them. I mean, some people will have them, you can see a bump and we'll push and just pus. It's awful. Like, it really is. And so now they are changing. It's sad because, other people could have probably told them that, but they're like, oh, this works, let's screw this in. And like 80% of the metal ones were failing. It's like you spend all this money and then it just gets infected and comes out anyway. It's like they were not having good results. So now they're changing what they're using. But yeah, it's awful what we see.
So they actually, they recommended that lavender and melissa to pre-treat the area before you do have an implant, because it will help prevent anti-biofilm activity and inhibit microorganism growth. So I, of course, have to find another study. And they weren't necessarily in this study talking about, not using metal, but they were talking about using essential oils, cinnamon and clove specifically, pre-treating and treating the area during having the implant. And it says that that it was immediate that it killed the organisms and the bacteria in the area, and that it kept going for 48 hours.
I just took my son to the dentist last month to get, he had a tooth that didn't come down, so they had to go up and drill in there and attach a chain to it to pull it down so he could have braces. And I asked him if I could they gave me all these prescriptions, and I said, can I just use clove and On Guard? And he uses essential oils at home, and he said, no, because he's worried about it being not sanitary enough.
It's
I
the
said,
funniest
okay.
word. It's not sanitary.
And I said, okay, and did it anyway, of course, and it was like healed the next day. I mean, he went and played a volleyball tournament the whole day the next day.
Yeah, she did not use the chlorhexidine on her son.
Stuff you're not supposed to swallow, by the way. Or it can make you really sick.
So the next one that they got into was root canals, and this one, like, you know, hit really close to home for me, because by the age of like 11, I had already had 4 root canals in my mouth, as well as I don't even know how many fillings. But by the age of 20, every single one of those root canals had failed, with the exception of this one right here. So I am missing my teeth, like 3 teeth on the bottom, 2 on this side, 2 on this side, 1 on this side. And so they redo the implant, or the crown on this side. And then I go to another dentist a couple years later, and he says, you know what, that crown is failing, I want to redo it. Twice they redo it until it finally gets so bad, but because I am vain, and I wanted my teeth to not be missing, and I smile really big when I smile, I was gluing my tooth up there myself, because my dentist said, I'm going to cement it up there. It might last 2 days, 2 months, 2 years, I don't know. It lasted a year, and it came out, and I was like, I cannot afford an implant. You know, it's like $3,000 on the cheap side. So I am going and getting Fix-A-Dent, and I am Fix-A-Denting this tooth to where it finally just came out, and then of course the black tooth chips out, comes out too, and we all learned what that possibly could be. And but root canals, it's the only dentists or the only doctors on the planet, I don't mean they're not doctors, but that will leave dead tissue in your body. Like if something dies, we clean it all out and we take it away, right? But then dentists will intentionally go up and kill the nerves, kill the root, leave a dead item in your mouth, and then put a fake tooth to cover up that dead thing. So when I'm asking, well, why am I paying thousands and thousands of dollars, and they all fail, and this one keeps failing, and they say, well, because they only have about a 5-year shelf life. Root canals and crowns aren't permanent. What? Who knows this, right? And they said, well, the problem is because it's impossible to fully seal the area. So, you know, bacteria will work its way up and work its way around and eventually start eating away the cement and eating away at the dead tooth and eating away at the gums and eating away at the bone. And the next thing you know, boop, your crown falls out and you're like, ah, and then there's a big black hole in there. So, but in all of that time that is going on, what stress is that putting on your body? So for me, I was able to actually kind of go back and look at the time that this went bad and how I spent that year sticking it back up in there. And then my cancer comes on really, 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 really rapidly. And then my cancer comes back. And then my cancer comes back for the 3rd time. And then I finally said, okay, I can't keep doing this nasty thing back in my mouth. So I went to the dentist and I had them remove it. And they did a bone graft. And they gave me this lovely chlorhexidine. And they say to you, okay, this is how you're going to use this. You're gonna dump it in. You're gonna turn your head sideways. You're gonna dip it in your mouth, and you're gonna hold it in that area for a minute, and then you're gonna let it drool out the side of the mouth. And then you're not gonna drink or do anything for 30 minutes because it's gonna ruin the rest of your teeth and it's gonna stain your teeth. About the gist of it. So, you know, besides the fact that it's like, you know, it's poison, it's toxin, and Listerine has the same concentration of this ingredient in Listerine that people use every single day, several times a day. It brings on high blood pressure. It's just, it's not good stuff. However, Ms. Dickinson did say that they discovered that using On Guard.
They actually just did it with peppermint.
It was just peppermint? Just mouthwash with peppermint?
Yeah, just wash
Was
with peppermint.
just as effective of
More
killing,
effective. Because the peppermint kills the biofilm and the chlorhexidine doesn't. The chlorhexidine only kills bacteria. And that was a PubMed article. It's just the bacteria. The chlorhexidine keeps the bacteria down, but the peppermint not only killed the bacteria, but it broke up
That was another thing
the
that it says,
biofilm.
is that it kills the good bacteria
It kills everything
in your mouth.
So yeah, the public medical journal actually said it's better just to switch with peppermint than to use our great
And to use
Paradise
this.
So do you think like the peppermint beadlets would work just as well?
No, you need to, it's a good thing to swish.
Swish and get it out.
And then spit that out. Yeah.
Right.
Because if you're swishing and pulling a whole bunch of bacteria out, you don't want to swallow. You're going to give yourself an upset stomach.
So
Just once a day, just do
I
it.
recently went in, and because, you know, like chemotherapy really like breaks down your body, I went in, and for the first time in my life, I had some 4s and I had a 5 when they were probing. 5 areas, and of course they want to prescribe me this. They want to put an injection of like an antibiotic into each little area. And I said, well, can I just do it myself and put clove in there? And they were like, whatever you want to do. So I chose to not buy this with insurance prescription. I think it's like $40 for this bottle. And instead, I just made sure I flossed really good, and I got up there and massaged really good. Went around with actually a Q-tip with clove all around my gum line, and then figured it couldn't hurt to suck on these. I'm sure they're possibly, perhaps, maybe helping inhibit the growth. Am I allowed to say that? So I thought that would be a good thing if you've got periodontal disease going on. You know, keep some cinnamon and clove in your mouth. So on to what she said. I found study after study of essential oils being used to and clove was the oil that was the overall in all of these to kill gingivitis. This was a mouth rinse used with clove, and what they discovered was that if they just did the fluoride rinse, that they did not have the same like killing of bacteria in their mouth. But when they did the combination of the essential oil, so they didn't do one that was straight just essential oil here. It was essential oil in combination with or without, and then it was highly more potent when they used the essential oil. This one was for plaque and gingivitis, and that it demonstrated an increasing plaque and gingivitis reduction over 6 months. And this one, and these are all like, you know, like 400 people on this study, 180 on another study, so it's not like they just, you know, took 10 people. This one's 185 people, and it just says that the clove rinse provided superior anti-gingivitis and anti-plaque efficiency compared to the the mouthwash that was just the CPC containing, which is, what is CPC stand for? Something poisonous, I'm sure. CPC. I'm sure it says it, I just didn't highlight it. Citafilidinium chloride. Something like that. Alright. So, the next one was mercury poisoning. And I don't know if anybody made it to the conference, to the doTERRA conference, not this last one, but the year before, and sat in the class that was taught by the girl that had the mercury poisoning. And it was really fascinating to find out how she narrowed it down to that she had her silver fillings taken out, and that if the process is not done properly, you can actually end up ingesting the mercury, and then she ended up getting poisoned from that. And she was ill, like thought she was dying, and they couldn't figure out what was wrong with her until they did tests and realized that she had mercury poisoning. And then the only thing that she had done was she had had those fillings removed.
So they say you got to be careful when you get them taken out, because it releases more mercury getting them taken out than having them in for the rest of your life if they do it wrong.
Right.
And so people were rushing in and getting it out, and these dentists were doing it. They weren't trained. They didn't know what they were doing, and they were causing way more problems. And now they don't even use it for mercury anymore.
But you know,
just leave it in there.
but a lot of us have it.
If it's done right, it's good to get it out. If it's done wrong, it's better just to leave them in for the rest of your life.
I have one.
I have one.
I have two.
All the rest have been taken out, but I have one. But you know, it's linked to mercury poisoning is linked to so many diseases. And did you have?
No, you have mercury poisoning.
What?
Some symptoms?
There's like a ton of symptoms, like pretty much the symptoms of like arthritis are a big one that kicks in, is having your whole entire body ache and having your joints aching. Fibromyalgia is one of them. The list is like this long of the symptoms.
I'm not sure if I'm saying it right, but my mother died of sepsis.
Sepsis?
Yes. An infection in her blood. In 1980, she had a dental implant done at USC Medical School. It's a full metal jaw, and it rested in her mouth, and in 2013 she passed away from it. From that, I can remember the oozing coming out of her face the last time I seen her. So, yeah, she was very vain. She wanted those teeth.
Yeah, it's hard for me to not.
Yeah.
But there's, you know, Alzheimer's and arthritis and just a lot of chronic diseases that could be triggered by having mercury poisoning. And the way that they kind of will test it is they'll have you like chew vigorously, and then they have like a little reader. And some conventional dentistry will say, well, you're actually exhaling more than you're inhaling into your body. However, if you think about it, every time you're eating, you're releasing some mercury into your body if you have that. What was this one? Let's get to making some toothpaste.
I have a quick question for
Yeah.
you, Vaughn. So, like 2 years ago, I busted out 2 of my teeth, and it's been a very long 2 years and lots of dental issues that I've had because of it, along with bleeding gums. Like they're uncontrollably just talking, my mouth would just start bleeding. And so when I did some research, it was talking about helichrysum. Did you come across any of that in your research?
Okay, I did not, because I'm strictly kind of going off of my PubMed. However, bleeding gums was something that was a huge side effect during my chemotherapy, and so that's why I have my helichrysum out, because this one worked really well to help stop the bleeding gums. Like I literally was like, I mean, most people bleed between their teeth. I was like bleeding out the front of my gums. So, yes, helichrysum worked really well for me personally to help get that clotting process going. Okay, so if somebody wants to turn on the microwave for a minute. Oh, we will. Okay, so The doTERRA On Guard toothpaste I think is awesome. However, you know, some people might not use it because they think that it burns or they just don't like the flavor of it. So you can actually make your own holistic toothpaste pretty easily. So as soon as, I guess we'll do the cleaning of your mouth
I
first.
was at a dental convention a few years ago, and some guy had done a study. He was in other countries and realized there was a certain group that had a lot of cavities and one that didn't. That's really the pH of your mouth. You want it to be less acidic. He actually said you can get a toothbrush, put it in water, just put it in baking soda. Because it's the plaque, you're really trying to get off the plaque. You really don't even need toothpaste. And so you just put a drop of peppermint on your toothbrush with some baking soda, you could brush your teeth with it and be fine.
That's my mouth prep.
Oh, is that is? Yeah.
Jumping in!
Okay.
So while that's happening,
How do you find a holistic dentist?
so if you just Google holistic dentist in Las Vegas, you will get a list of them.
Really?
And then I would look at their reviews and see, but just keep in mind that most insurance will not cover your holistic dentist. So, however, you just have to kind of weigh the.
So if you don't have an implant, what are your choices? To go without? To do a break?
Just smile from this side.
Arr, and be a pirate for Halloween. Need it. Okay, awesome.
It's really hot.
Cool. Okay, so the first ingredient that you're going to need, and this was really easy to get, you know, like an organic bentonite clay. I just ordered it from Amazon. It was pretty inexpensive, and this is going to make a lot of toothpaste. And what I'll do at the end is I will go on to Jones Up and Running, and I will post the recipe for the toothpaste, and then I will post the procedure of how you should be spending 5 minutes every morning and 5 minutes every night to clean your mouth. And I don't think that that's a lot to sacrifice if you really think of all of the health problems that you could eliminate by having a clean mouth. So the first thing is we are going to take the bentonite clay, if I can get it open, and a third cup.
Up and
this is like
running.
A really like fine clay powdery stuff. So kind of you want to have like a dust storm going on.
What is that, Allie?
That one is the bentonite clay. So, what you want to do is you want to mix that with a 1/4 cup of really hot water. As I trip, take my shoes off. I have it. Okay. So, I'm just going to stir this in. It's going to make like a thick paste, a really thick paste. Very clumpy. Huh?
We're now at the Cooking with Ali show.
Cooking toothpaste with Ali show. So it's going to be kind of like a little bit chunky-ish. I'll show you like that. But we're going to put other ingredients in here, so don't worry about that. Does anybody know of a natural teeth whitening remedy?
Charcoal.
Hydrogen peroxide?
Yeah.
Sure.
Lemon? Baking soda?
Not stuffy at the enamel.
Strawberries with lemon and hydrogen peroxide make a paste.
The hydrogen peroxide, we've seen people burn their whole mouths using hydrogen peroxide, so be careful with that.
Do not brush your teeth
It can
and
burn.
then put the hydrogen peroxide, because when you brush your teeth, you get all these little micro tears all over your gums, and then you put the hydrogen peroxide in and your whole mouth turns white, and it stings. Okay, so you're gonna mix that up. Then you are going to, if you want, you don't have to, you can put some stevia, because, you know, toothpaste usually has like a hint of, you know, like a little bit of a sweetness. So
Up
that
and
you can
Running is a
tolerate it.
private group.
I'm only going to put,
Up and Running / Brilliant Business.
huh? What are you talking about? Okay, and then Himalayan sea salt. You guys can even get this at Winco. And it comes in like a very, it's going to come in like the rock form. So I just throw it in my blender and blend it up. So it's going to be 1/4 teaspoon of sea salt. A little heavy on that. And then coconut oil. Y'all know you can get for pretty inexpensive at Winco. You can get a organic coconut oil for $11. That big guy. So we're gonna add a tablespoon. Since it all didn't come out, 2 bits. Okay. And then, so there was many different flavors. So if some of you don't like that whole on guard thing, the cleaning process that I'm going to show you, the toothpaste is really a polishing because there's going to be so much other cleaning that's going on without spreading stuff around that it's really just a polishing, and you really just need a very, very small amount. But some of the recipes that they came up with was lemon, lime, and grapefruit, and that one is refreshing and cleansing. Chamomile and wintergreen for healing. Orange and clove, peppermint for cleansing. Melaleuca and lemon for cleansing and balance. And frankincense and myrrh for spiritual. So I figure let's just do the lemon. What is it? Lemon, lime, and grapefruit. That might taste good. So I'm going to put 10 drops about of each one. And since they come out like liquid, that was more like 15. And then we are just going to work that all around, and you're coming up with a little paste. So can you guys kind of see? It looks like I've made concrete. Yes, you guys can taste it. You can all polish your teeth. Okay, so you'd want to work it a little bit better, but once you've done that, then I would just put it in, you know when you, it doesn't, but you guys, do you know how to determine what plastic is safe for your essential oils and what is not?
No. Like
Okay.
1 or...
Yeah, so anything that has a triangle, well, it's going to have your little triangle, right? A 1 and a 2 is safe as long as it's diluted. Even a 3, anything above that, it's gonna leach the toxins. But those are the plastics that are safe to use essential oils.
Where did you get those?
Not in dollar store.
Yep. They come in a pack of like 6 or something.
Yeah.
Really? Yeah.
This is so.
At the dollar store.
They're great for deep blue samples.
Yes, they are.
Which dollar store?
So
99 cents.
pretty much. Yeah, 99 cents. So then, after you've made it, you can just put it in your little container and keep it by the
That looks yummy.
Yummy. Right? So, and then, with the lid on, it'll store for quite a while. You don't have to store it in a refrigerator or whatever. But now, since we talked about how bad and dirty, disgusting our mouths are, right? It is pertinent that we clean our mouths. So another one of these holistic dentists, she came up with an 8-step program, but I actually narrowed her down to a 6-step program because most of us don't have like the little syringes to go up between our teeth. So, but the big thing is that before you do anything in your mouth, and this is really important, if you don't do this every day, please at least do it before you go to the dentist, because you don't want them probing and spreading all of that nasty and poking it up and you're bleeding and now you're getting that even worse going on in your mouth because they've really traumatized your mouth when you're at the dentist, right? So baking soda, alkaline, and frankincense. Before you do anything, you rinse in your mouth and swish it around vigorously for about 30-45 seconds. Then you're gonna spit that out.
Put like the baking soda in some water, or what do you?
Your mouth will like salivate like crazy. So you can just put a little bit of water. I usually, basically I just open it, I put it in my hand, or
And then what
Just
do you
like
do with
that.
the frankincense?
then I open my mouth and I go drip drip with the frankincense, and then I start,
Just like that.
and you get going just like that. Okay. Then most of us don't have tongue scraping tools. However, you can use a spoon, and you are going to scrape your tongue. You're going to go as far back as you can without gagging yourself, and you're going to apply pressure, and you're going to scrape, and you're going to rinse in hot water. And you're going to scrape, and you're going to rinse in hot water until you've scraped your entire tongue, because that is where all of the bad stuff is
What about
our
brushing your tongue
tongues.
with a toothbrush?
No, you won't get there. Don't be jumping ahead.
Sorry.
Okay, so now you've scraped it all out. Because now, when you get to this is not a toothbrush. This is a tooth scrape. Okay, so when you put this thing in your mouth, because this is the next, it's going to be dry, or at any one of these steps, you can put any essential oil that you want on there. But you're going to go in, and has anybody, or hopefully you all know this already, that you do not brush your teeth like this. Or like this. You're damaging your gums. You're receding your gums when you do that. You want to put that sucker in there, and you want to go
With a soft toothbrush.
with a soft toothbrush. This is a soft toothbrush. Like that's, if you should never own anything other than a soft toothbrush. If you have a hard toothbrush because you think you've got to screw up your teeth, go throw it away. You're doing more damage than you could possibly imagine. So you're just going to get that thing in there, and you're just going to.
And you can do, if you turn your toothbrush at a 45-degree angle, you can do little circles. People just go up on their gums and then they recede their gums back. And so you can do a small circular motion. People just usually do it wrong.
So remember, it's not a up, it's a from your gum, pull down, pull down, pull down, rinsing, rinsing, rinsing. Okay, then that's when your toothpaste comes into play. So now you're just going to put a small bit, and if you have a spin brush or a Sonicare, this is the perfect time to pop that sucker out. If you only have a toothbrush, then you just need to be very careful, and you're just going to be polishing your teeth. So it's a very delicate kind of motion of polishing your teeth. So think about when you go and the dental hygienist cleans your mouth, and they use that little itty bitty thing, and they just kind of go like on each tooth. They're not like, right? Okay, so don't do the same thing to yourself. You're just going to polish your teeth. Okay, then you're going to rinse that all out. Then, and once you guys do this and you have it sitting on your sink, it's 5 minutes. Then you're going to get your floss. And what I like to do, because it's really hard, and you'll see if you're like, oh, okay, I'm going to put floss oil on my floss, it's just going to go, and then you're going to wrap it around your fingers. So what I do is I just put the oil on my finger, and I didn't bring the study. However, there is a PubMed study that shows that cinnamon is actually more potent at killing microorganisms and bacteria and all of that stuff in your mouth than clove is. No. PubMed. I just didn't bring it. Okay. So, cinnamon at this point, and it burns. I'm not going to lie to you guys, it burns, but it's worth the burn. So you just put a little bit of cinnamon on your gums, and then you floss. Okay, now when we floss, do you guys go like this and pop? So, but when you go up and you floss, you need to go up. You need to go up. Not over. Not over. Okay? It's not. Okay. So you're gonna go in. You're gonna work up. Get all that. Rake it up. Rake it up. Rake it up. And then. And you're gonna do that for every tooth. It's not It's faster to do that way, but it's not.
And you don't have to, but
beneficial.
you can come back out, like you don't have to pull it through. I don't know where that's, like, was that a study you read?
The pull through comes from that, say you have lettuce or something stuck up in your teeth, right? And you go ahead and you pull it. Have you guys ever done that?
Yeah.
And then you felt it wedge even further down in your teeth? So this way, you're getting it, you're loosening it, and then you're getting it to come out.
Some people
Rather
might, if
than
you've had
coming in.
dental work done, some people might get it stuck in a lot of spots that like it might shred and tear on
Right.
something. So if you have
There's,
a space, then come back.
just play, if you have places that shred your tooth, your floss, then I would definitely recommend going to your dentist because they have like a little tool that they can go in there and they can file and try to help that from happening. However, there's a lot of, I would just play with dental floss until you find one that's strong enough to get in between your teeth and not shred. Because if you're not getting in between that teeth, that biofilm every 12 hours is just linking and linking and linking and linking and linking, and you've got tartar and you've got gingivitis and you have gum disease between those two for sure.
Excuse me. That one, back to the tongue scraping. What about babies, like 5-year-olds? Don't you clean their tongue?
I
hold them down.
Takes two.
Dude.
You know, being that I'm not an expert in the field, I don't know if I want to even go there.
What was she asking
It's just
about?
if you have like a baby.
It's a I'm not a baby, she's 5. She's my
Like a 5-year-old. They
Right.
actually make tongue scrapers that are long that you pull sideways and you just pull down on your tongue. It is unbelievable what comes off your tongue. But under age 20, like a lot of kids, their immune systems are so fantastic. They just don't have the bacteria that adults have. Like 5-year-olds don't get periodontal disease. They don't, like their bodies are just like unbelievable. They get the
Periodontal
cavities.
usually starts 30s, 40s.
Yeah,
is
you
when
have
people
to be
really start
careful
problems.
in 20s is, but you have to be careful. Like they need to keep their mouth clean, but the bacteria on a little 5-year-old's tongue is not going to destroy their bone. Like it's just what they find. Like, but I tell my kids, we have tongue scrapers. You can find them online. They're long and skinny, and they're flexible and they bend if you don't want it because the spoon kind of gags. And it's crazy what comes off your tongue. Like
Makes
crazy.
you not want to like kiss anybody.
I use my toothbrush and cold water prevents me from gagging.
Yeah, and
That's
one
it. Make
thing.
my whole mouth cold and
One thing that's important is the bacteria in the mouth, it's not contagious, but it's transferable. So if you have periodontal disease or you know you do, you shouldn't be kissing on your kids or you're transferring it straight into their mouth. And so we'll have some people who have really good teeth and their husbands don't, and they'll say, why am I having problems? And the first thing I'll say is, what does your husband's mouth look like? Oh, it's horrible, it hasn't been in for 3 years. I'm like, stop kissing him. Like he's transferring all of that right into your mouth. And then you're gonna have, and then you have the micro tears and it can cause problems. I mean, like she said, we're seeing strokes, heart disease, all these problems, and it's coming back to the mouth. And so, like, yeah, it's super important to keep your mouth clean.
I skipped over heart disease. Yeah, because stroke and heart disease is like a big thing. The plaque in your mouth is the same as the plaque that they find in your heart. So when you have that plaque in your mouth and the bleeding gums, and that's going into your bloodstream, it actually goes into your heart, and it is the same plaque, and that's why they say that 80% of cardiovascular disease comes from mouth. And then the final step, just to be really quick, would be pick whatever your favorite oil is, and then put it on your finger and give yourself a really good gum massage, and really massage those oils up in and around your gums, and then just spit it out or whatever, and you're good for the next 12 hours. Make sure you're doing that twice a day.